Demetrius?
We work across Essex.
Yeah.
So, I don't know, Sonia, please feel free to chip in. What one of the things that we have been doing is we've created locality forums, or fora if you prefer, where professionals from different services and third sector come together in order to discuss the most complex cases.
Right.
That tend to appear and reappear with a lot of self-harm and a lot of risk. And that a lot of times help us create communication between the services. And it also it creates a collaboration that is for the benefit, and it leads to helping the service users to receive a treatment that is actually what they want, if I may say. This was created after consultation with service users. There is a service user network that it's been developed across the service, across the input, across Essex. And after a lot of consultations, they have created groups for self-help, but also some groups that help us. They have input on how we design the services.
Great.
So that's one.
So,
Yeah,
maybe I'll add something. Maybe I'll add something, Demetrius. So I think, so basically our service, it's been developed very much thinking about their 10-year NHS long plan in terms of the community mental health framework. And it's about, you know, obviously we are a team that works mainly with adults, but we like to think that we age inclusive in the sense that we're very, very interested to develop better pathways for younger people transitioning to adult services. So there's a part of our service that is working a lot in that side of things, how to make transitions easier for younger adults. But we also, you know, we also have an understanding more and more than just with the introduction of the ICD-11 that we like to see personality disorder as a continuum.
Yeah.
So something that also happens for older adults. Reason why that we like to think that we're a bit more age inclusive, and we like to work more in a form where it's not so much about diagnosis and having a formal diagnosis. It's about reaching out to the wider system and actually ensuring that those people who might fall through the gaps not be picked up in time, diagnosed appropriately, and access treatment are kind of being picked up somehow. So we've been developing different ways of working. So obviously we do, unfortunately, work a lot with people who self-harm as well, because we know that there is some people with some, probably with more some types of personality disorder tend to present with self-harm. So we work a lot with that, but it's not just about self-harm. And I think Demetrius touched base in some of the offers that we are developing locally to really reach out, not just to NHS services, but to colleagues outside in the community, in other areas, social care, voluntary and third sector organizations. How do we include the wider system? So there's many things we're doing. And a lot of the work we're doing is really thinking about developing a system that is more personality disorder friendly, that, and that as well includes self-harm, building some resilience as well in the system of how to work with these clients who present, with self-harm, and sometimes present in a way that can be really difficult for services and professionals and families and communities to manage. Really, it's a quite difficult situation to manage. So as part of that offer, we're developing different things, and some of the things Dimitri spoke was we're developing these multi-agency complex needs forums that it's open, and anyone working in health and social care, or voluntary third sector that comes across this population that they might not have a formal diagnosis, but they attract the diagnosis. There's a clear indication that they straight, there's a clear indication that they attract the diagnosis. And these forums are a way of providing that kind of multi-agency approach where we're trying to offer several things. We're trying to offer consultation for colleagues. You know, it's about supporting services to work better with this client group and ultimately meet the needs of this client group in a system approach, not an individual service, because we know people with personality disorder often present with a lot of other complexities, isn't it? It's not just the mental health, it's the housing, is relationships breaking down with the neighbors, is, you know, we name it. It's difficulties accessing services in other areas. So we understand that there is the value of bringing services together to really think through about, you know, are we not getting things right for this individual? Where in the system, or we can offer something that will meet the need of this individual, or sometimes even thinking about working more flexibly, coming together as a few services together to think about how we're going to do this, you know, how we're going to support this individual. So very much thinking about as well transitions, not just for young adults, but transitions from hospital back to the community. How can we improve care for people with personality disorder, for people who self-harm as well? And I think, you know, there was something said in the first part of the presentation about involving service users, families, carers. And I think that's very much at the heart of what we're doing. And Dimitris was saying that we developed what we call the service user network for people who have personality, people with a personality disorder. And it's becoming something really huge and great, because what we're doing, it's not for clinical purposes. So we're not offering interventions in that service user network. It's more for what we're offering to service users is a space where they can get some psychoeducation. They can get a space where they can get to know others who have a similar experience as they have. They can relate to. We are offering, you know, we sometimes will invite colleagues, you know, psychologists or colleagues from different services to come and do a talk about a topic that is chosen by service users. And we also developing the other aspect of that service user network that is about co-production, involving service users in that co-production, in shaping services, in designing services. So we're doing a lot of things like that. Yes. We provide a lot of training, for example, and it's all with service users involved in co-facilitating training with us as well. So it's just a brief.
Yeah, no, that's absolutely fantastic. I mean, and this idea about, you know, systems. So, you know, I think in a lot of areas, people have started with, you know, their pathways for people with, you know, so-called personality disorder or personality disorder pathways. But I think, you know, realization with you guys locally and more generally that it's about a group that's much bigger than that. And actually, the service changes that you're instituting are a much bigger group of people than just those who self-harm. So I think the system stuff and the other things I really liked about what you were saying, Sonia and Dimitris, is, you know, there's support for the service user there as well, but there's also a recognition that staff may have particular needs, both in terms of training and other support. And then I think the other crucial thing really that, again, is picked up across the country, but it's really recognizing the importance of transition. So it's not just transitions from, you know, for example, kids to adult services, but it's when people are transitioning between different bits of the system,